invited. It's absolutely amazing to be in a room like this and see people who probably each and every one of you have been involved in campaigns fighting to save your services. I want to start by giving a sort of green perspective and overview of how we see health. And what we say in the Green Party is the NHS is struggling, but one of the reasons it's struggling, it's not just about the money and the privatisation, it's because the whole of our society is sick. We see appalling inequalities, poor housing, a rotten public transport system, which means that people use their cars and the air quality is terrible. About 30,000 people a year die early due to air pollution. People can't get adequate good food. A lot of the illness that we see is almost certainly due to pollution. So I think it's just really important to put this argument about the NHS into that wider context. And I don't want to dwell on this because it's obviously a Defend Our NHS rally. That's why we're here, to talk about that specific issue. But I do think it's important when people talk about health to say, or talk about the NHS, to say, okay, you care about the NHS, do you care about health? And do you care about the things in society that make us healthy? And just to expand the argument a bit. But coming on to the NHS itself, I think it's really important that we're clear about what we want. You know, it's obviously really important to fight for the things that we don't want, the cuts, but it's also important to say what we do want. And I'm sure everybody on the platform would be very clear about that and already have been. But for me, the things I would pick out is the NHS needs to be properly funded, and I think it's a nonsense to say that it can't be. We're the fourth richest country in the world. There are huge inequalities, and we need to be brave and say we just need to tax the wealthy people and corporations. And people sort of talk about the NHS as though it's a drain on resources, but as well as being, an important ride for us, it's actually an economic driver. It's actually one of the places where people could get good, meaningful employment. And it could boost local economies if there were lots of local hospitals. I want the NHS to be person-centred, not driven by targets. I want it to be integrated with social care. At least social care should be properly funded so that there isn't this fight between health and social care. I want a proper balance between the high-tech, the hospital, the acute services, the curative services, all really important, but also a balance with community services and preventive services. And I want good workforce planning and training. Now, what I would say is, you cannot have those things in a marketised system. The two things just don't go together. I need to be absolutely clear here that I, Green Party, are against the purchaser-provider split. The admin costs are huge, so it's reckoned that before manufacturers' original changes in the 80s, admin costs in the NHS about 5%, they're now probably 14%. Different estimates of what that costs, but probably it's enough to fund all the GPs in the country. The target culture, because we're chasing after ticking boxes and working out the cost of everything, that's infected the whole of the NHS. Integration with social care, well, as a councillor, city councillor, I know that social care has suffered far more privatisation than the NHS. So there are people working as home helps and carers who are paid an absolute pittance, and that means that the service is poor and often actually collapses, putting more pressure on the NHS. And just fragmentation of all those services. So this isn't just about private companies taking profits out of the NHS, although that's bad enough. It's about the way that marketisation and privatisation fragments and destroys a public service. So, what would we do? Well, Louise has already mentioned, and you've probably, some of you will have leaflets on your chairs. I saw somebody putting these out. The Green Party is backing the NHS reinstatement bill. This goes further than saying what the Clive Efford bill did. Good in that it was saying we want to reverse the 2012 bill. Great that Labour is promising to do that. But we need to go further, because the marketisation and the privatisation started long before 2012. So what Labour are actually saying in their 10-year plan is that they would retain the purchaser-provider split, unless I've read that wrongly. They talk about the NHS being the preferred provider. Great, but for me that's not far enough. So what are the main features of the NHS reinstatement bill? Well, you look it up on the website. It's a brilliant website, very accessible, with all the bill written out in detail, but also good explanations. But key things: Secretary of State has a legal duty to provide a comprehensive service. We declare the NHS, this is a technical term, a non-economic service of general intent. And if it's a non-economic service, then it automatically comes out of EU competition regulations and is saved from TTIP. So we just need to make that declaration and be clear, it's not there as a market. We would abolish, or the NHS reinstatement bill would abolish the purchaser-provider split and competition. And it would work by setting up local health boards, which would gradually come together over a period of years. We don't want a big bang approach to it like we've got in Manchester. We want local groups to be able to come together, see what works, and set up what would be called health boards that actually run the local NHS. How amazing! So this bill is being supported by the National Health Action Party, obviously. It's supported by a huge swathe of Green parliamentary candidates, no Tories as you might expect, a handful of Labour, and it's being put as a private member's bill tomorrow in Parliament by Green. Wide support from all the parliamentary candidates. I hope that all the parties come on board. I hope that, in amongst your campaign about local things, you can really push this as a national issue. I think it's a really excellent piece of legislation to all get ourselves around, because it puts forward a really positive vision of the NHS. And I think, why is this time so crucial? We've seen over the last 5 years a sort of continuation of the previous 25 years of kind of neoliberal privatisation, and people have become depressed and can't remember what it's like to have a proper public service. So we need to actually go out there, debate how we can set it up again, and plan for it and live in hope that it's going to happen.